Welcome to Chatting with Chat. Today, I'm super excited to introduce Bonnie Barnes. Bonnie is the co-founder of the Daisy Foundation, an incredible organization that honors the work of nurses all over the world. Thanks to Bonnie's leadership, the Daisy Award has recognized thousands of nurses who are making a real difference in the healthcare community. I had the chance to meet Bonnie a few months ago, and after hearing her story and just seeing the incredible work she's doing for the past few years that I've seen it, I knew I had to share her inspiring journey with all of you. So, Bonnie, welcome and thank you again for joining us today.
Thank you, Chad. I just want to say one thing up front. It's not just me.
Yeah.
There is a big team of people behind the Daisy Foundation now. And most importantly, my beloved husband, Mark Barnes, who is, in my opinion, the visionary leader of this organization. So thank you for your warm words.
Yeah, no, I think that's such an important thing to mention is it's never just one person. I always go back to the saying I had in investment banking training that teamwork makes the dream work. And we definitely abide by that here at Care+Wear. So why don't we start with your background? As you know, when I had started Care+Wear, it was to help my loved ones fighting cancer, just trying to get a better stock over a PICC line. Can you tell us more about the Daisy Foundation and how you even came up with the concept?
Well, I think like you, so often we come up with the concept out of our own need. And in
Yeah.
this case, the need that Mark and I had was to say thank you to nurses who had taken care of my stepson, Patrick, Mark's son, who had been in the hospital for 8 weeks fighting an autoimmune disease we'd never heard of called ITP. And when he died at the end of those 8 weeks, and we started thinking about what could we do to fill that gaping hole in our hearts, and what could we do to cope with this incredibly awful roller coaster experience we had just been on, we found ourselves continually talking about the care of Patrick's nurses. We thought they would be great from a clinical perspective, and they were, but we never anticipated the level of compassion and sensitivity they would show Patrick and all of us in our family. And when he died, we realized our hearts were filled with gratitude to his nurses, and we needed to find a way to say thank you. So it was out of need, just as you described the start of your organization. We created DAISY, standing for Diseases Attacking the Immune System, with the intent of giving other patients and families and coworkers a way to share their gratitude and their stories of the things a nurse had done to make a difference in their care. And we figured we'd do this in 5 or maybe 10 hospitals around the US. We'd feel better. We could go back to doing what we were doing before, and
Yeah.
go on. Today, there are more than 6,900 healthcare facilities and nursing schools in 43 countries committed to honoring nurses month in and month out with the Daisy Award. Never in our wildest dreams did we think it would become this big or this impactful, more importantly.
I think that's so amazing. And I think what's even more special is even as you've grown, you've stayed true to your mission and really pursued the why. I think I told you when we met, my mom's an anesthesiologist, and she always taught me that the most important person in the room is the nurse. So get to know the nurse. That's who's going to really ensure that you get taken care of. And I think what you're building is so, so important. And I always get a smile in every healthcare facility I go to, where I get to see a sign talking about the Daisy Foundation and how you all have honored their nurses, et cetera. So a lot to be proud of. As we talk about seeing those signs and seeing nurses be so proud to get it, can you provide a little more insight into the process of how healthcare organizations determine the criteria for nominating nurses for the Daisy Foundation Award? And are there specific qualities or achievements that you typically look for?
Well, you alluded to this in the start of your question there, which is it's actually the healthcare facilities, all of our partners, we call them, who choose their own honorees. We encourage them to create criteria that are in keeping with their mission and values and the way they describe nursing excellence, but it's all under the banner of compassionate care. It's not that we don't have huge regard and expect inclusion of great clinical excellence, but compassion be part of it. So each organization writes their own criteria. They have a committee of nurses and often other people on the committee, could be patient family advisory council members, chaplains, physicians, others who serve on the selection committee, and they receive the pool of DAISY nominations from the electronic nominations that have sign work around the hospital, or from written nominations, or even letters that are sent to the CEO that describe a great patient care experience. They put all those into a pool. They blind them. Most importantly, this has got to be a high integrity selection process. And they choose the nominations, among the nominations, according to those criteria they've established. So each program's run a little bit differently, and that way we wanted it to be flexible enough to fit the culture of each organization that adopted it. And that's how it works.
I love that. And I love your focus on compassion. I know for us, I call it the Care+Wear Street Team. But every year, honestly, every quarter, our team normally goes out on the streets here in New York and just says thank you to nurses. I think it's one of those things that not enough people thank people for the work that they're doing each and every day. And I think it's so amazing to hear the personal stories that people have of the nurses and the care that they received. And I really, really love just how much you're doing to help others. And so I think. I mean, I'm kind of talking a little about what we do, and this is probably a bit of an obvious question, but something that really gets overlooked quite frequently is why is it so important to recognize nurses for all their hard work and compassion?
Well, I want to start from the people who actually write the nominations.
Yeah.
Over 3.2 million times, a patient or a family member has taken the time to share their story and their gratitude. And we know from research we've done and research we're now working on how important it is to the patient and family to get across to the nurse the difference they made. It's a therapeutic reflection for them. And there's tons of evidence now that indicates why it's so important to patients and families. But for the nurse who's receiving these nominations, it connects them back to their purpose. It reminds them why they became a nurse. It recalls their passion for caring for others. At a time when healthcare is now so complex and so technology and task and decision-making ridden, it's
Yeah.
so wonderful to remind nurses that the little things they do are really magnified when we as patients and families are in their hands, and that they have to pay attention to those little things, because that's why providing that kind of care is probably what inspired them to become a nurse. So that's kind of the around the circle thing of why it's important to patients, why it's important to nurses, and the impact is very heavily evidenced now.
Love that. How have you seen recognition through the Daisy Award impact the nurses who receive it? And what effect does it have on their colleagues as well?
Hmm, That's a great question, Chad. I have to just give you a tiny bit of background. Mark and I
Yeah.
Mark and I worked in advertising and marketing, where there are awards for pretty much everything.
Yeah.
So when we came into this idea of creating an award for nurses, we didn't know that there was no award for nurses around their compassion. We didn't know that healthcare leaders at the time didn't think that they needed to have an award. So we had a little bit of concern, though, that sort of like what it's in business, that everybody would politely applaud this nurse getting the Daisy Award, and then they'd look at each other and say, "Ah, I did all that stuff. I could have gotten this award. Why not me?"
Yeah.
It's what would have happened in advertising. That doesn't happen in nursing. We have been blown away by the acceptance of the entire team of nurses and others who see in their colleagues something special and want to elevate it, who want to celebrate them. So it's really been incredibly refreshing to see that it has an impact across the team. We build into the Daisy Award celebration a way to celebrate the team, acknowledging that every single Daisy honoree says to us, "I didn't do this on my own. I do this with my team. Everyone here deserves this." So we have a way to acknowledge that inside the actual celebration kind of presentation script. But yeah, it's been really refreshing. to see how nurses accept and celebrate each other now. It's wonderful.
I love that. And then finally, from your experience, what are some of the most effective ways to advocate for change in healthcare?
Well, honestly, I'm not an expert on anything to do with healthcare outside of meaningful recognition and the Daisy Award, to be frank with you. However,
Yeah.
we are on a mission to get the public to be speaking up about nurses. So when you describe what your team does, going out and saying thank you to nurses on the street, if you will, I love that because really we in the public need to acknowledge the unique, vital role that nurses play in our society. We need to give them all the appreciation and respect and resources we can. And the role of the public on ensuring we have a healthy nursing workforce is really important. So we're working hard to make sure that the public is aware of all the great work that nurses do. It's why we're really looking to create awareness of DAISY outside the walls of the healthcare organizations that have the program and get it into local media, make sure that nurses' stories are getting out into the media so the public has a better role. That's the only thing that we know how we can impact change in healthcare is through public perception. I mentioned I worked in advertising before.
Yeah.
But I will leave to the great organizations like the American Organization for Nursing Leadership to come up with the strategies to really improve things for the workforce.
It's kind of like thinking of the nurse as the rock star or the superstar is kind of how we talk about it here at Care+Wear. We had spoken about it, how nurses are the heart and soul of creating every product we create. Like without nurses, I would have never known for a PICC line cover, for example, that you need a mesh window to allow for breathability or visibility. And we have a bunch of nurses on our advisory board, and then we've actually just launched a nurse design council because, to your point, I mean, nurses are on the front lines each and every day and understand what's needed and oftentimes want to be involved. I still remember when we started the company, I had people, nurses talking to me at like 1 or 2 in the morning, and I was like, I understand why I'm doing it because I'm starting this company. What the hell are you doing with that being your only free time? Like, why aren't you sleeping? And they were just so passionate about providing better patient care. And I think that's been so important. So I have a few rapid fire questions for you. The first one, and honestly, I'm pretty sure I know the answer to this, but I still want to ask, what is your favorite book?
Oh, that is a great lead in for me to talk about the book behind me, Shining a Light
Yeah.
on Light. 5 years ago, Mark and I felt strongly that we needed to get our story of how we went from Patrick's bedside to, at the time, 20 years later, over 4,000 healthcare facilities partnering with us to honor nurses. So we wrote this book, actually, a fabulous ghostwriter named Jim Eber wrote this book with us, and we put it out for sale 5 years ago. A lot has happened over the last 5 years, and we felt it was important for us to update the book in celebration of Daisy's 25th anniversary. So what you see behind me is the 25th anniversary edition that came out late last year. We're very proud of it. We have an ebook, and Mark and I actually recorded the audio book, which is available on Amazon. So, right, that's my favorite book. Sorry to do a
Yeah.
hard, but I can't wait for it to get in the hands of nurses. It's got a lot of joy about how nurses influenced the creation of the Daisy Award and all that we do. Just like you have nurses that are advising you, Chat, the same is
Mhm.
true. Nurses have taught us everything about how to make recognition meaningful for them.
I love that. And just to make sure everyone heard you when you said it, not that this is a commercial, but how can you purchase your book?
Well, you can get personalized signed copies by us on our website, daisyfoundation.org/book. You can get a hard copy of the actual book itself, of course, and the audiobook and the ebook through Amazon. It's called
Perfect.
Shining the Light on All the Right, Celebrating the Art of Nursing Around the World.
Love that. Okay, a couple other quick questions. What is the last TV show that you binge watched?
I just finished the sixth season of Virgin River. I so need to watch things that are not relevant to today's world. I don't watch medical shows. My husband and I watch a lot of crime stuff, but which is
Yeah.
focused. But honestly, I needed to see something that was kind of light and joyful. Virgin River fit the bill.
Love that. I'm gonna have to check that out. And then I think to your point, what's been so amazing about seeing you all, even over the last 10 years, is just how you've expanded, not just across the country, but around the world. And I know you've been really blessed to be able to go to a lot of different locations around the world. What's your favorite city or country that you've been to?
Oh boy, that's a tough one. I have to say, we do a lot of work in the UK, and I love
Mhm.
traveling around the hospitals in the United Kingdom because
Yeah.
the NHS is a phenomenal health system. We love what they're doing with the Daisy Award. And so that's not a city, obviously, but it's throughout the country. And
Country,
similarly,
yeah.
we've been all over Saudi Arabia,
Mm.
where I always say whenever we go to Saudi Arabia, there is not a yellow, green, or white balloon left in the country because they're all in the hospitals creating these massive celebrations of the Daisy Award when we're there. So it's always great fun for us to see the Daisy Award brought to life with nurses' tremendous creativity, no matter the culture, because nurses are nurses everywhere. And
Yeah.
we get to see that compassion shine through in every culture. So those are two countries anyway that we especially love traveling to, but we love traveling and visiting nurses wherever they are.
Love that. Thank you again. This has been so incredible. And thank you to you and Mark for the just unbelievable organization that you've built and being able to say thank you to nurses. Kind of like when I told you the first time we met, it was just such an honor for me to get to meet you and speak with you. And so proud of everything that you're doing and excited to help recognize even more nurses and thank even more nurses and help them realize that they are superstars and each and every person is, regardless of whether they are honored with the Daisy Award or not. I think what you've done such a great job of doing is making everyone realize that we wouldn't have today's world without them. And so thank you so much for the amazing work you all do, and thank you for participating and chatting with Chad. And we're so excited for the future together.
Thank you, chat. Let's stay in touch.
Yeah,
I
awesome.
really enjoyed